Hey there, I'm Sandy Starr, and I am with Dr. Kremer from Delmar Integrative. And we wanted to chat today about stem cells, but first wanted you to chat about yourself and a little bit about your background and how that's going to relate to our conversation.
Yeah, hi Sandy, and so I've been an emergency physician. I was an emergency physician for 41 years, and one of the things I discovered about being in emergency medicine is that probably 85% of the patients that came into the emergency department were there because of bad choices, and these bad choices could have been because they just didn't know, or they didn't care. So what I've tried to do with my Delmar Integrative Medicine is teach people how to be healthy and help them with some chronic problems that they may have.
Okay. So how did you get into stem cells?
Well, in doing therapy for people, I initially started with a medical spa. Actually, I have a medical spa at my clinic where I do Botox and fillers. And then I started doing PRP. Now, this is before stem cells. But I do have to tell you that I went to my very first stem cell conference in 2007. And so that was like before there was any around, and the ones that were around were being shut down. So, but I was very fascinated by it. So I started doing PRP, which is platelet-rich plasma. That's where we use your own blood. And I started doing a PRP facials and joint injections, because PRP has all the healing parts of your blood in one part. We spin it down and take the one layer off that has the platelet-rich plasma, which is the healing portion. So I was doing that and getting good results. They have growth factors in it, and they help people get relief. But stem cells are one step above that, or more than like 5 steps above that, because stem cells can regenerate. Stem cells can turn into muscle, bone, ligaments, tendons, cartilage. And so they're generally, when we inject stem cells, they go to where they're needed. They go to where the inflammation is, and they start to regenerate. In fact, just as an example, going to where the inflammation is, that's why when we do stem cells, we tell people not to take NSAIDs, that's like Aleve, Motrin, Advil, those kind of medications, not to take them for 30 days, because we want that inflammation to be there so the stem cells are better directed.
Right. So controlled inflammation.
Yeah. And so you're always treating inflammation. Anything with itis in it is inflammation.
Yeah.
Arthritis, tendonitis, appendicitis, they're all inflammation.
Right. Yeah. So there's a big question out there that I've even run across is, where do they come from and what types are there?
Okay.
Stem cells.
There's actually 3 major sources of getting stem cells. You can get it from your bone marrow. Usually they go in the hip, the bone of the hip. They put this big spike in there and draw out the stem cells, so they get it from there. You can also get it from adipose tissue, and that's where they'll do a little liposuction on you and take some of your fat, and there's a whole process they go through to get the stem cells out. And where we get our stem cells from is placenta. So women who have C-sections, who have signed up for our program, they get their medical history and everything, and everything is done according to the FDA regulations. And then when they have their C-sections, they get to keep the baby. We get the placenta. And one time we took the baby by accident, but we did give the baby back. But we get the placenta, and our labs do a whole barrage of tests on the placenta to make sure it's good, and that's where they extract the stem cells from. Now, there's different types of stem cells that can be gotten from the placenta. So you can have cord blood You can have placental tissue, and there's Wharton's jelly. Wharton's jelly is like if you took a cross section of the umbilical cord. There's a gel-like substance that holds the arteries and veins in the umbilical cord, and that gel-like substance has stem cells in it, but it also has growth factors. So I like to call it stem cells with the soup. So we use that. I like to use Wharton's jelly for especially joint injections. So like about 3 months ago, I tore my rotator cuff doing an incline dumbbell press. Turns out I was the dumbbell, and so I got an injection of stem cells right where the tear was, and a month later I was playing pickleball again. So, and that's the differences between the three sources of the stem cells. If your adipose tissue, your bone marrow are as old as you are. So if you're 60 years old, you're going to be getting 60-year-old stem cells. The nice thing about the mesenchymal stem cells that we get from placenta, they're brand new. They're the youngest legally available source of stem cells that there is. So, and that's why we use them. It's also, it spares you getting another procedure besides the injection.
Right, that's good. So they are not taken from aborted babies.
No, that's illegal. We don't do any kind of embryonic stem cells. They're all from the placenta when after a woman's had a C-section.
A C-section, right? Okay, yeah, because that's a big thing that people get confused about, and then also the ways that we get the stem cells. So, what are some of the conditions that they treat? Because it seems like quite a bit, and there's different ways to do it, in injecting in the joints and IV therapy. Can you touch on that?
Yeah. So generally I do a lot of joint injections. So if people have bad knees or bad shoulders or elbows, in fact, I'm going to be doing an elbow in just a little while here. Just like I had the tear in mine. So we do a lot of joint injections, but we also, so I'll give you an example. I had a 64-year-old guy here come in, and he had degenerative disc disease all up and down his back, and he couldn't even turn his head. And so I said, well, look, I'm not going to inject every level of your spine. I mean, first of all, it costs a fortune. Second of all, it'd be a little uncomfortable to do that many injections. So I said, let's do intravenous therapy. So we combined stem cells with exosomes, and I gave him an IV. And I called him 2 days later, and he was like ecstatic. He says, I can turn my head. I don't have any pain anymore. He immediately sent his wife in to get it. And he had a big firm, and he sent his general manager in to get it. And some other friends, that he sent. He was so excited about the results that he got just from that's the intravenous. So it's a good anti-aging formula also. The stem cells and the exosomes, they go to where they're needed. That's the beautiful part. So if you have it could be a damaged organ or anything damaged, that's where the stem cells are going to do their work.
That's fabulous. You touched on exosome. How can I say that? What is that, and where does that, is that a stem cell? Is that?
Exosomes come from stem cells.
Okay.
But they're not actually cells. They're nanovesicles. They're so small that there's 15 billion of them in a fifth of a teaspoon.
Wow.
Now, mind you, I've never counted them.
Yeah, who has?
But they signal your own stem cells to do a better job. It kind of wake them up a little bit, do a better job of regenerating, repairing, and restoring function. They also have a very strong anti-inflammatory effect, which is good. And the great thing about exosomes is because they're so small, if we give them intranasally, we give it through the nose, it goes all the way back to the cribriform plate and can go into the brain, crosses the blood-brain barrier where a lot of things can't get through.
Correct. Wow. That's crazy.
So I use it for neurologic problems that people have had a stroke, for example, or maybe they have Parkinson's disease, or I try intranasal therapy.
That's fabulous. I have somebody in mind for that. So if somebody gets a treatment, how long does it last? I know it really depends on the individual, but what are some of the successes you've seen with that?
Well, it really kind of depends. Again, it does depend on the patient. I'll give you a good example. I had a neighbor of mine who lived across the street from me, and he comes over to me. He says, "Hey, Arnie," my first name. He says, "Arnie, my orthopedist says I need a knee replacement." He said, "But I don't want to get a knee replacement. Can you try stem cells on me?" So I said, "Sure." So I did stem cells, and he got like tremendous relief. But 6 months later, he was having to have a little pain again. So I asked him what he wanted to do, because here's a guy who was told he needed a knee replacement. So he said, "No, I want to try another injection." So I gave him a second injection. That lasted 2.5 years.
Oh, that's
So
great.
that's pretty successful, And then I just gave him a third injection. So it's been 3 years since he first saw me. He's still got the same knee. He hasn't needed a replacement yet. And after the third shot, he's been doing well. That was probably about 6-8 months ago, and he's still doing great.
That's great. I guess that kind of shows you that if we're starting to have those degenerative things going on, that we look at this before we're told we have to replace something, right? So it can help heal a lot quicker, more preventative than that.
Well, the other thing to note here is a lot of and this is not a put down by any means, but a lot of physicians don't know much about stem cells. Because we all kind of get stuck in whatever field we're doing. We don't have time. Like an orthopedist doesn't have time to learn about bioidentical hormones, for example.
Right? Yeah, not in their field.
So a lot of them don't know that much about stem cells, and it's a growing field, but it takes time. It's the early adapters, and then more people. It's kind of an inclined plane. It's like the automobile started out with early adapters, and they realized they had to put something in the holes in the road, and they built better highways, and more people started to use it. So it's the same thing with any new field of medicine or new product, and so. But stem cells have come of age. They have definitely come of age.
Oh, that's wonderful. So, I mean, pricing really varies. So what you want to hopefully get people to just call you. We do have the website delmarim.com. There's a drop-down service menu for stem cells. There's a lot more information on there. But also you can schedule a free consult with Dr. Kremer. And because it is individual, so it could be that you just need, I don't know, an injection in your knee rather than an IV, and you wouldn't know that unless you really ask a lot of questions, and he as well, right? You ask a lot of questions. So yeah, that's what we'd recommend is for jump on the website or call the office and schedule a free consult. So 858-925-8233. Again, it's Dr. Arnie Kremer from Del Mar Integrative Medicine.
Yeah, and if you give the website also, you can request a consultation via, if you give her the email, you can request a consultation via our email, which is office@delmarim.com.
Yeah. So either way, lots of ways to get.
Yeah, if you request it by email, I will call you. Otherwise, you can call the office also and schedule a consultation.
Awesome. Sounds good. Awesome. Well, I'm looking forward to it.
Yeah,
definitely.
It's a great therapy. I've had I've mentioned my shoulder, and actually I had the other shoulder done too. I had a personal trainer that was a little too aggressive with me. He didn't realize I was little. I was not 25 years old. And I've had the IV too. And that's why I look so young. I'm actually 97.
No, I thought you were 120. Oh well.
Yeah, right. That's my goal.
There you go. Right. That's regenerative medicine, right? So, all right, well, thank
And by
you.
the way, when I do give you a consultation, I also go over a lot of different things. I talk about diet, anything. I know a lot about inflammation. I wrote a book on a plant-based eating program, so I can help you be part of your own healing process.
Yeah, that's good. That's a whole, regenerative, integrative, and then we do the functional medicine together, which is all about lifestyle, nutrition, and stress management. So,
Right.
so this is just a little tiny piece of what we do in the office. So yeah, you can call us and chat about any services we offer. So we look forward to seeing you, and thank you for jumping on.
Thank you.
Okay.